All right, so let's go ahead and get started. We're at about 2:05. We do have some people dialing in from Pittsburgh and from Harnett. So just wanted to tell you, they can't see you. They see this part, right? What you see up here is what they see.
Yeah, they look lonely.
But just want to give you a little heads up. There are microphones in all rooms on all campuses, so please keep your comments and your questions down until they're asked for, because this is being recorded as well. So it will be available on our HR Blackboard site under professional development after the session. So if anybody wanted to attend and they couldn't make it, let them know. It'll be up hopefully by the end of the week. We do have one up from earlier this week, but hopefully this one will be much better. So we'll put that up. But yes, please keep your voices down and wait for questions. With that, I'm going to hand it over to Terry, and you're going to be introduced to our new healthcare options. So this session is called Taking Control of Your Healthcare.
Okay, we'll get started. I did send out an email to all full-time employees that were covered under benefits with some video and slideshow presentations, as well as the new rate sheets for the upcoming year. You're not going to see a lot of change in your rates. I think they went up an average of about 3.5%. So this time during open enrollment in the month of October, the state has moved every employee into a 70-30 plan, no matter what you're currently on. If you don't want to remain on that 70-30 plan, you have to go in and make a change. If you don't care that you're on the 70-30, then you don't need to do anything because you're covered. They've moved you into that plan. So we're going to go through a little PowerPoint presentation that talks about why the changes are being made and the new plan options, and introducing the wellness incentives that will help you decrease the amount of the premium that you have to pay if you do these incentives. This just talks about why the state's making the changes, because it's being mandated that we make these changes for the Affordable Care Act. And we're changing our calendar year from July to June to January to August. You're going to be on a calendar year now, not a physical year, as far as your deductibles are concerned. These are the three plans that are going to be available to you. It's called an enhanced 80-20, which is almost like what the 80-20 was previously, but it does have a few more incentives to it. They do now offer preventative services at zero payment. There's no copay, there's no deductible applied to that. You don't pay anything. And there's also preventative medications that you don't pay anything for when you go to the doctor. There's the new wellness incentives, which we'll go over those individually in a minute. And if you do those, like I said, they'll help reduce your copays as well as the premiums that you pay each month. On the new consumer-directed health plan, which they're calling the CDHP, with an HRA, which is a health account that they put money in there to you, health reimbursement account. They'll put money in there for you to use if you go with this plan. But it does have a higher deductible. Until you meet your deductible, you pay everything. You pay all your doctor's visits, there's no co-pays. You pay everything until you meet the deductible. After that deductible, it goes to a 15% copay. And then once you reach the co-insurance amount for the remainder of that year, it goes to 100% payment. You won't pay anything. It also has the zero cost for preventative services and medications as well. That plan does. And I'll explain to you about the health reimbursement account when we get to a couple pages over. The 70-30, if you were in that plan, it's not changing at all. You won't have those zero payments for the preventative services and medications like you do on the other two. And you don't have to do the incentives because the 70-30 doesn't cost you anything anyway, and there won't be any change in that. the 80-20, the wellness credits for the 80-20 and the CDHP plan. Please look up assessment. You name a primary care physician and you fill out a smoking cessation or attestation form saying that you either don't smoke or you're trying to quit smoking. And if you don't fill it out, they say, okay, he smokes. And you won't get the credit for that. If you do fill out the, if you assign a personal care physician, a PCP, every time you go to that doctor, instead of the $30 copay, you'll only have a $15 copay if that doctor is designated as your PCP. And if there's a $10 specialist copay, if you go to a designated Blue Cross specialist, if he's your, or if him or her is your PCP. And there's a zero inpatient hospital copay for utilizing a Blue Options designated hospital. And I'll tell you up front right now that Duke Hospital at this point is not a designated hospital. They're still in negotiations with Duke. UNC, Wake Med, most of the other major ones are at this point, but Duke is not right now. They hope to have it on before January when the plan starts. On the CDHP, it's pretty much the same for doing those 3 wellness incentives. And it's the same thing on the $15. When you go in that health reimbursement account, there's going to be some money out there for you to use. And if you go to your primary care physician, they're going to give you another $15 in that account to use later as well. Every time you go to your primary doctor, you'll get a $15 credit. When you go to a primary specialist, you'll get a $10 credit. And if you go to one of those hospitals, you'll get a $50 credit in that account. Traditional 70-30, none of that applies. This just talks about the wellness incentives. And when you go into the open enrollment, which we're going to show that later, you'll be able to do all 3 of these things. You'll be able to name your primary care, you'll be able to do your wellness, and you'll be able to do the smoking cessation thing. A primary care provider does not necessarily just have to be a general practitioner. They can be a specialist. Internal medicine, pediatrics for your children, if you're covering dependents. They can even be a licensed nurse practitioner or a physician's assistant. And you do have the opportunity to change your primary care physician during the year. If you name that person in January and you want to switch doctors, you can change that primary care at any time. But before you go to that doctor, they said to give them about a 30-day period in there to get everything switched over to your new primary care. This just says a little bit about how they can be designated a provider. They have to be, their criteria is they have to have quality health outcomes, they have to be cost effective, accessible to the members, and the hospitals have to meet certain criteria as well, what types of specialties they do. This is just the changes in the 80-20. Just says it has a new name. It's now called the Enhanced 80-20 instead of just the 80-20. It talks about the new preventative care that you don't pay anything for, and it talks about the primary care physicians only having to pay that $15 copay instead of the $30s when you go. And if your doctor's in a practice like Sanford Medical Group or Pinehurst Surgical or something like that, if he's not available for you to see, any doctor in that group would be considered your PCP because they're in the same group. If you had to see another one when you went to visit the doctor. And then down at the bottom it talks about the specialist where you receive that $10. You pay the $10 copay reduction, and then to avoid that $233 in-hospital copay, you would select one of those designated hospitals and you wouldn't have to pay that. This is the premium reductions you get for doing these health incentives. If you do the smoking cessation and you say, I'm on a program trying to quit, or I'm not a smoker, you'll get a $20 credit in your premiums. If you complete the health assessment, that's $15. And if you name a primary care provider, that's another $15, which is going to give you a $50 credit towards the 80/20 premiums on employee only. Those credits do not apply to your dependents. The new premium for the 80/20 is $66.46, I think, a month. So you wind up paying $13.46 a month if you do all three of these, which is really cheaper than what we're paying now. It's about $9 a month cheaper than what you're paying now to stay on the 80/20. These are just some things you can do to reduce your cost and stay on the 80/20 by visiting those PCP doctors and getting that $15 copay. When you visit the specialist, you get a reduction of $10 in the copay, and you don't have to pay that $233 copay at a hospital if you go to those designated providers. And you also get the preventative services and medications at 100%. Some kinds of preventative medications you were looking at would be maybe like birth control pills, high blood pressure, that kind of stuff. That's some of the free things. It does give us a little bit of a list later on in this slideshow, but you can look them all up on the website as well. Yes, here's the one for the preventative medications. I thought it was coming up. The smoking patches, you know, if you're trying to quit, that's something that's free as well. It does have some stipulations, like on the last one where it talks about contraceptive coverage. If you're over 50, it's not going to pay. This is the highlights of the new 80/20 plan. Gives you your deductible amount for in-network and out-of-network. And your co-insurance amount is the 20%, just like what we have now. The co-insurance maximum that you would pay with your 20%. And then the co-pay for the doctor, unless it's your primary care, is going to be $30. $70 for specialists, unless it's Blue Options designated specialist, it would be $60. And then you get the 20% after the deductible on the inpatient hospital. And then you see the drugs are pretty much what they've always been. They didn't really change much as far as what you have to pay for the different tiers on the medications. This talks about the CDHP. This is the new plan. And they kind of on the side call it the high deductible plan because you have to pay so much up front before it'll pay anything. It covers the same services pretty much as the 80/20 plan does. Does have a higher deductible. It's $1,500 for an individual, $3,000 for an out-of-network. After the deductible is met, you only pay 15% instead of 20% like you do on the 80/20 plan. And the deductible applies to both pharmacy and medical expenses. So if you have to get something at the drugstore and you pay $20 for it, that $20 is applied to your deductible, as well as the doctor visit charges. If you reach your deductible and co-insurance out-of-pocket maximum, then the plan covers everything at 100% after that. And on the health reimbursement account, they set one of those accounts up for everybody that's on this CDHP plan. They'll put $500 in there. You have a $1,500 deductible. You can use that first $500 out of there to cover that, which means you really only have a $1,000 deductible. And if you go to your PCP or you go to one of these designated hospitals, then they're going to give you those $15 and $20 credits back in that account to give you a little bit more money. If for some reason you don't use that $500, it rolls over into the next year. You won't lose it. Like the health savings plans that we offer here at school, if you don't use that money, you lose it. But on these health reimbursement accounts, you don't lose it. If you have employee and one dependent, you'll get $1,000. If you have an employee plus 2 or more dependents, you'll get $1,500 in that account. And once you deplete that money, the doctor's gonna file your claim with the state health plan anyway. You're not gonna have to pay up front when you go in there. And they'll pay it until that $500 is gone, or however much money you have in that account. And then when they don't pay the doctor anymore because your money's gone, then the doctor's gonna bill you. So you don't really have to go into the doctor prepared to pay anything, because they will file it for you. After you meet the deductible, the member pays the 15% like it said, except for the affordable care, preventative services, and medications. They're covered at 100% like they are in the 80-20. And the pharmacy and the medical deductions and out-of-pocket are shared, meaning the health expenses and the medical and the medicine expenses get applied to the deductible. An additional CDHP preventive medication list is covered with no deductibles, meaning that you're subject to 15% of the eligible expenses only. It says that the deductible does not apply to every medication because you get the preventative ones at 100%. But anything that's not considered to be preventative is subject to the 15% copay or co-insurance with no deductible. This is just an example of how that HRA account is going to be set up. You see, in employee only, you have a deductible of $1,500. The first $500 is going to be covered by that money they put in that HRA for you, which means you'll just have $1,000 out of pocket. And then once you pay that, you only have a 15% copay. And once you reach your copay maximum, then it's 100% paid. You don't pay anything anymore. And it just goes down and gives you the same scenario for the employee and dependents. This is an example of how that would work when you get the $15 credit. And the examples on the right side where it says the individual's deductible is $1,500. He goes to the doctor, it's $175. He goes to the drugstore and it's another $6,500, which means he's got $1,260 left to satisfy his deductible. Down at the bottom, his HRA account has $500. The doctor and the pharmacy are going to bill that account for the $175 and the $65, leaving you $260 in that account. But then you're going to get a $15 credit because that doctor was your primary care provider. So you'll go back to $275 in that account. This talks about the wellness incentives, just like on the 80-20. The amount that you get for the credits is a little bit different because the premium for the CDHP plan is $40 a month for employees only. So the incentives will come up to that $40 amount. You won't pay anything if you complete all 3 of those incentives. This is where it tells you how that $15 and the $10 and the $50 gets added back into that HRA account. And just a reminder that your preventative services are at 100%. This is an overall highlight of that CDHP plan, giving you your deductibles, which we've pretty much talked about all of this already, unless anybody has any questions about it. The traditional 70-30 is the plan that everybody's being transitioned into beginning January 1. If you want either 2 of those other plans, you have to go online and change it and fill out your 3 incentives. The traditional 70-30 is just like it's always been. There's no changes in that plan. You don't pay anything as an employee. and your dependent coverage is going up about 3.5%. This is just the highlights of that, which are the same that they've always been. You have a $35 copay at the doctor, $81 copay for your specialist. You have a $933 annual deductible for individuals. You're in hospital, it's $290 copay, and then 30% after the deductible. The medications are the same. The medications and drugs are the same on all three policies. All three policies. This tells you the rates for employee only. On the 80/20 plan is $63.56 per month. If you do all the incentives, your monthly premium is going to be $13.56 a month. If you do 2 of the incentives and you decide that I'm not going to stop smoking, then your credit is going to be $30 a month. And you would pay $33 instead of the $13. And then it just goes down to different tiers as to what the premiums are if you're covering dependents. This is the same scenario for the CDHP plan, where you can see for employee only, if you do the wellness incentives, you don't pay anything for that coverage for the whole year. And then you can see what the dependent coverage is. The traditional 70/30 is still free like it's always been to the employees. You just have to pay the dependent coverage if you're covering anyone. You must take action to make these changes before the end of October. If you don't make these changes or do any of this before the end of October, you're going to remain on that 70/30 plan for the whole year of 2014. You will not be able to change to a different plan. We are not, the open enrollment is e-enroll for us. We are not on the Beacon system. We're on the e-enroll system. And down at the bottom, it tells you that you can do all of those changes through this website, shp-login.hrintouch.com. You can also go to ebenefitsnow.com and get in the same way. Your user ID to get in is your first name, the first initial of your last name, the last 4 of your social security number. And if you've never logged into the healthcare system before, your password is going to be your social security number. If you've ever logged in before, your password is going to be what it was set in the beginning. You can reset it. You can say, I forgot my password, and it'll come back and give you the opportunity to change it. Or I can change it. If you call me, I can go in and change your password for you. You should be receiving mailers at your home address to explain all this to you. I think 2 of them have gone out so far, and they said there's going to be 2 more. I'm not sure what's going to be the content of those other 2, but pretty much the ones that you've got have kind of explained it to you. There's also, down at the bottom, there's a little electronic newsletter that all members can get by just signing up for it. And you can sign up for it on that website where you go to enroll, or you can go to shpnc.com, statehealthplannc.com, and sign up for it. It's called a member focus. It comes out monthly, and it does tell you some updates that might be happening on the health system. Like I've been getting them yesterday and today all day saying, okay, this site's down, this is not working, tell your employees, blah, 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 blah. Something's not working right. If anybody calls you, tell them we're working on it. And of course, that kind of things wouldn't come out to the members. That would come out to me as the health representative. But you do get updates of things that are happening. Tells you about wellness programs that they have going. Tells you about weight management programs that they have going that you can participate in as well. You can also call if you have any questions. Either of these numbers listed, or you can dial 7289. That's me. That's what most people have been doing. Okay, that's the presentation. Does anybody have any questions after that? And then I'm gonna kind of bring up that enrollment screen and show you how to get into that.
You have 3 assessments that you gotta go through, and, you know, I believe it's 20-15-15 for the 80-20 plan. And going and doing your self-assessment, you know, it's already got your health condition in there.
Yeah.
So basically, you know, by just doing it, you're not gonna get to $15, I don't think. I hadn't run mine yet.
By just,
Uh,
yeah, you can't.
Yeah.
No, you can't, no, it's no questions like that. The questions, if, as long as you fill it out, no matter how you answer those questions, you'll get that $15 credit.
Even if they put you at high risk?
Yes. They can't put you at a high risk. There's no pre-existing conditions anymore or anything like that. As long as you fill out that health assessment, and all it is questions like, do you eat healthy? Do you go to the doctor regularly?
So it's not a physical exam?
No,
Oh.
no, it's just, takes less than 2 minutes to do it online. I think I did mine in 60
But if it comes back
seconds.
and it says you're high risk,
That doesn't matter.
it's got 3, you know, your normal, your moderate, high. and your high.
This assessment doesn't rate you in any way whatsoever.
Okay, so if you do it, you get the $15.
That's correct.
Okay.
And like I said, it's no personal health questions really about, have you got kidney disease? They don't ask those kinds of questions.
But it's already there.
Yeah, and well, they would know that from reports they've gotten from your
Yeah.
doctor.
That's what.
But they don't ask those kinds of questions. It takes less than a minute to fill it out online. Do you eat well? Do you sleep well? Do you visit your doctor regularly? That kind of stuff. That's all it asks. And on the smoking cessation, you either say yes or you say no. And then you can do a search on your primary care doctor to make them activate as your PCP. That's all you have to do. It takes less than 5 minutes to do all 3 of them. And you're gonna get those credits regardless of how you answer them.
Whether you feel or pass.
That's right.
It's participation.
Participation gets you the credit.
I just want, you know, you couldn't really go online and answer some of them, the smoking and the other, you know.
Not until October 1st.
Right.
Right.
I could now, but when I did my self-assessment, you know, it would not allow you to do anything. So you really didn't know, I really didn't know whether it was gonna give me the $15 or not.
Yeah, it will, regardless of what you do. As long as you go in there and fill it out and complete it, you get the credit. Yeah. And like you said, the smoking cessation was not on there until October 1st. You couldn't do that until then, but you could assign your PCP and do your health assessment prior to that if you wanted to. And as far as I know, they haven't said any different. All that information will carry forward each year. I don't think you're gonna have to do it on a yearly basis. I haven't been told that. Have you seen anything that said that?
They're going to have different wellness activities every year, but they're going to determine them year by year. So we don't have any information in advance of what they're going to be. They could be the same, they could be different.
Okay, Dacia's gonna log into her account so we can bring up the screen and show you what it's gonna look like if you need to go in and do those assessments and switch your plan. Okay. This is going into the ebenefitsnow.com website, and it brings up a page that looks like this. There's an enroll now on this side, and there's also an e-enroll on either side you click on. It's going to get you to the right screen. Okay, we're looking at Dacia's records. It's her profile, which is personal information, and then you would click on benefits. When you click on benefits, you see current benefits and open enrollment benefits. On the open enrollment benefits, you'll see view edit information. If you click on that, this is where you would go in and edit the plan that they have you on. If it'll say you're on the 70-30. You would edit that, change it to the 80-20. And on the premium credits, that's where you would go in to fill out the assessments. When you get those assessments filled out and assign your primary care physician, it'll come back with these credits right here, and it'll show you what your total cost is going to be for the next year. And on your primary care physician, like I said, you can go in at any time during the year and change that if you want to, from one doctor to another. If you decide you don't like this one you're going to, or if you want to change your primary care to some type of specialist that you have to go to all the time. You won't need to do anything on the Medicare as far as, nobody here has that. If you're actively working for the state of North Carolina and you're 65 years old, then you would have to. Or if you had any dependents, like a child who was on Medicare, you might have to go in and make some changes there. This is where you would add or delete dependents. You got married, you had a baby, you got a divorce. Those kinds of changes can be made throughout the year. The only thing you cannot change during the year is from one plan to another. You can't go from 70-30 to 80-20, 80-20 to 70-30 or to CDHP. The one you've chosen by the end of October is the one you're going to have all year. Once you would go in to do these adjustments, let's just look at Dacia's, we're not going to change anything, but you would just click on this open enrollment and next, and it would prompt you through the steps to make those changes. If you want to go back to the 80-20. I did mine yesterday morning, it took less than a minute to do it. I switched back to the 80-20. Does anybody have any questions?
I have one.
Okay.
Where do I go if I want to see those charts you had to compare again? Is that on the
It's in that
website?
presentation that I sent out in the email.
Okay.
All of those are. Or you can go to that shpnc.com website. And there's a big link up there that says 2014 open enrollment. If you click on that, it'll give you a list of links that you can bring those rates up as well.
And then my second question is, you said everybody moved to the 70-30 plan.
Yes.
So if, does your dependents move with you, or do you have to go back in and add them?
They move with you. If you had dependent coverage previously, they move you and all your dependents to the 70-30.
Okay.
And you do have to assign a PCP to each dependent, and they have to do the health assessments as well. It's not just employee only. You have to do those for each dependent that you have.
But I can do it for my dependents.
Yes,
Okay.
you can do it for your dependents.
Okay.
Any other questions? Yes,
So
ma'am.
I noticed that you had different hospitals listed as a primary hospital. Where do you find that information? If, like Central Carolina Hospital here in Sanford, if they are a primary?
You can go on to the shpnc.com website, and you should find a link to your designated hospitals. You should be able to find it on there. Let me see if I can see that. This is the shpnc. Well, it was.
.org.
I gotta do www.
.org.
It'll come up under .com too. Has been. Been coming up under .com. It's not there. Okay. .com didn't work today. You'll see this 2014 open enrollment right here. If you click on that, it brings you up all kinds of options down here at the bottom. This is Medicare primary retirees. If you're retired, you're 65, your Medicare is going to be your primary coverage. This is some links that you could get in there and see. There's your rate calculator, the rate sheets that you asked about, Peggy, right here. That shows you the rate sheets. I was looking for the link for the doctors.
And I think for the hospitals is my question. I found the one for the doctors
Yeah, the
somehow.
doctors is here. You can find your doctor here.
I just wasn't able to find the hospital.
Let's see if plan provider, inside North Carolina, Blue Cross Blue Shield plan provider search. Find a doctor or facility.
Thank you.
Uh-huh. And you go down here and do a search on the name. And when you're inside the open enrollment, once you search your doctor, you can just click add, and that makes him your primary care. And this tells you, like, let's just say I'm gonna look up my doctor. Last name first. See, here's my doctor right here, and if I look over here, this tells me what plans that doctor will accept. Like they'll accept the Blue Options, Blue Advantage, Blue Select, and you can see more. Blue Options State Plan, State of North Carolina, PPO plan. That's just the different kinds of insurance that doctor will accept and file claims for you. And I'm not in the enrollment process, so it doesn't give me an option here to add it. I'm just on the regular web page looking somebody up. If I was in the enrollment process, right over here, there would be an add button where you would click and it would put him in. If we want to look up a doctor or a hospital, let's say, there's their information. And you can tell whether they accept the state plan or not if you click under plans accepted. Let's just look up Duke Hospital for curiosity and see what they say, because they're not on our plan, we were told right now. They're not listed. Duke Cancer Center, there's Duke Cancer Center.
Keep scrolling.
Duke Home Health, Duke Hospital. Duke Hospital's not there. Let's see if any of them are on there. Children's cardiology, let's just look them up. I don't know, zip code in Durham.
Try 27518.
Okay, the oncology hospital has got us in there, so maybe they've got them added to our plan now. When they originally gave that information out, they were not on it. So maybe they've accepted it now. I would think if cardiologists, children's cardiologists take it, that all new facilities would.
So that one's in Burlington. Does location matter, like clinic versus hospital?
It shouldn't.
Shouldn't.
No, it shouldn't. That one's available. It shouldn't matter if it's affiliated with Duke.
Okay.
Any other questions?
If you went to someplace like the Rapid Care, would you look up Rapid Care, or would you have to put in a specific
You
doctor?
need the doctor's name, I think, because Dexter, weren't you trying to look that up the
I
other
put in
day?
the specific doctor's name, and he came up.
Did you try the Rapid Care alone?
I
before
believe
that?
I did, and I couldn't find it that way.
I think you did, but I'll try it. It's just called Rapid Care, right? Like the one beside of Kmart that we talking about?
It's searching.
It's okay.
Got it. Oh, there it is. It did find it. But that's a facility. You still have to put the doctor's name in your file under your primary
That's
care
what it was.
physician. Under your primary care physician, it still has to be a doctor's name, not a facility. Any other questions?
So if he left that facility, though, you'd have to change your primary doctor to one that was there,
I would think so,
if
yes.
that's where you wanted to go.
Yeah. Because he wouldn't be affiliated with them anymore. If he was still affiliated with them and you went to another doctor there, that doctor would be covered.
Right.
But if he's not affiliated with them anymore, I would think you would need to change your PCP.
Yeah, so you can go to anybody in the facility and still pay the lower copay,
Yeah.
but you have to have at least one person in the facility listed as your primary care.
And that's just for 70/30, right? Because if
No,
you're
that's
80 or
Now, 70/30, you don't have to list the PCP.
so if I go to a doctor that's not my primary care, but the deduction in premium does not matter whether I go there or not. I'm automatically given that $15 premium reduction just
Yes.
because I selected it.
Yeah.
Whether or not I go there or
Whether or
not.
not you go to that doctor or not, you don't have to, but you're getting that credit because you selected one. You just don't get that $15 deduction in the copay when you go to somebody else.
Yeah, you get it on your monthly premium, but not, like you were
Not on
saying,
the
not when
copay.
you go for your copay.
Okay, our time's about up. Any more questions?
When is the open enrollment for the vision?
That's not until April. Mhm. Okay,
Will the
thanks.
supplemental, will it run on the same calendar that the supplemental insurance, like the vision, the dental?
No, that's still June to May on your other coverages for vision and dental and life. All that's still gonna remain on the June to May period. The health insurance is moving January, December.
Well, those things in the cafeteria plan, is that what we're talking about? The vision and
Yeah,
all
like
that,
the
where you
yeah.
contribute and then you hold it and you, if you don't spend it all, you lose it.
Oh, no, that's the health savings plan.
Okay.
That's different. That's the health savings plan if you're contributing pre-tax money to an account that you can use towards medical expenses. And that's the one, if you don't use what you've contributed by the end of May, you lose it.
But it is tax sheltered. That
Yes.
portion is tax sheltered.
Yes, it is.
Where the 80/20 is not.
Yes, your 80/20 is tax sheltered too.
The
Any
premiums are-
premiums you pay on health care is tax sheltered. The only non-tax sheltered thing that, contributions that you do is life insurance. If you have supplemental life insurance, that cannot be pre-taxed. Any other health care can be, vision, dental, health, whatever.
But if you're retired, it's not tax sheltered, right?
I thought it was. I'm
You get
not,
no income.
well, they take it out of your, if they take it out of your retirement check, it would be tax sheltered.
Okay,
Yeah,
okay, maybe it is.
it should be. If they're deducting it from your retirement check, which they would, then it would still be tax sheltered. Okay, thanks for coming.